Well, I'd like to start off by speaking about our cats. And cats have a reputation for being very finicky. And that makes it all the more difficult when a cat becomes ill and needs a medication, because how can you give medication to a cat that either won't eat it or just runs away? That becomes a real challenge to pet owners. I remember one Saturday, I had a woman come in the store, and she was all scratched up, and I asked what had happened, and she said, "I'm trying to give a pill to my cat." And I said, "Well, we have other options." And one of the options, which is pretty popular here at Hieber's, is the triple fish suspension. And what that is it's a special formula we have. It contains salmon, tuna, and sardine. And we mix these, kind of emulsify it so it becomes like a thick shake. And that's our base. And into that base, we'll put the medication, and then we'll adjust the dosage to what the doctor writes, and then dispense it in a bottle, 1 ounce, 2 ounce, depending on how much we're going to be giving, and with an oral syringe to measure the exact amount so the right medication dose is being given each time. And that's been pretty successful. I mean, I remember one cat would just come up to the owner when the triple fish suspension, the medicine, was taken out of the refrigerator. It's a treat for many cats, and this is especially helpful for cats that need either a small dose or the medication isn't available in cats, any kind of a cat medication. For instance, medication for people. Oftentimes we'll get a medication that's just available for humans, but it's not available on a dose for a small little cat or a kitten. We have formulations here because different drugs have different characteristics. So, say, for instance, a drug like Flagyl. It's given for infections. And Flagyl, metronidazole, is extremely bitter. In fact, I would venture to say it's almost impossible to make Flagyl in a pleasant-tasting preparation, period. However, we have a formulation using metronidazole benzoate, where there's a slight change in the dosage, but the active ingredient would be the same, and we can make metronidazole benzoate in a pleasant-tasting oral preparation for pets. We also do it for people, for children. The use of different salts of a drug can allow it to either increase in solubility or help it to be more palatable, and in this case, we're using it for palatability. Cats sometimes, for whatever reason, they're very difficult to figure out, become aggressive. And what we can do is we can put medication, give medication to a pet that's going to calm the pet down. There's been reports of cats being aggressive for no apparent reason, scratching, biting, and such. And it's hard to pinpoint exactly what the issue is, but we've been able to put various medications, even like a Prozac, in a formulation for a cat so that the cat will decrease its aggressive behavior. We could also put medication in chews. We can make little chewable treats for the cats, and the medication can be incorporated in that. Now, what I'd like to stress is that we work along with the veterinarian. We're not trying to compete with the veterinarian vet's practice. Oftentimes, as I mentioned earlier, the vets have medications for their pets, their clients, and I'm in no way trying to compete with that. What I am trying to do is supplement that, so that if there is a special need that the vet cannot handle because they don't have the equipment or any number of reasons, then we can work with the vet. So we work with the vet. So, sometimes people come in and they say, "Can you do this? Can you do that?" I say, "Well, I need to call the vet. I'm not doing this on my own. I'm working along with the vet." And nobody knows their cat better than a cat owner. And a question that I'll oftentimes ask is, what does a cat like to eat? And by letting me know some of the things that a cat likes, I'm going to make preparation so that the medication can be put in a flavor that the cat would like. We have one cat that likes turkey, so I got a special turkey formulation. Another one likes chicken. So each cat is unique, as you well know, those of us that have cats. So if we can work along with the taste of a particular cat, that makes giving medication all the more user-friendly. Now, there's another way that we administer medication to cats. In the previous broadcast, I talked about transdermal pain medication for people. In other words, I can make medication for you that you can rub on like a Motrin, and you can rub it on your elbow, your knee, your back, and you can get the Motrin through your skin, and you can avoid the stomach upset. Well, using that same type of concept, we can put medication in a transdermal gel for a cat. We usually preload it in syringes, and like 0.1 milliliters is the usual dose. And you would express out 0.1 milliliters, which is a tiny little bit. And we have little finger cots we give the owner, and you would squeeze that on a finger cot, and you would rub it on the inside of the ear of the cat. And why the inside of the ear, you might ask? Well, there's a few reasons. One is there's less hair there, and the second reason is that there's a lot of blood vessels, and the blood vessels bring the medication into the bloodstream of the cat. So by rubbing the cat's ear, we could administer like this flagyl metronidazole, for instance. If we wanted to use a regular metronidazole, which is extremely bitter, I can put that in a transdermal gel, and that can be applied to the cat's ear, usually once a day. It could be done more than once a day, depending on the medication. But that's a nice way, because I know my cats like to have their ears rubbed, and pleasant way of administering a medication to a cat that may seem to be extremely finicky as far as taking things orally. But I would ask any cat owners, if their cats have any health issues, give me a call. I'm here at Hieber's Pharmacy. That's HIEBER Pharmacy. And my phone number is 412-681-6400. Or you can email me on the website, info@hpharmacy.net. That's info@hpharmacy, HPHARMACY.net, NET.